How's it going, everyone? Welcome back to the channel. Today we're diving back into the world of medicine and learning how to become a general practitioner, commonly known as a GP in Australia. Now, if you've considered GP as a career, you've come to the right place. In this short video, I'll take you through the whole journey to becoming a GP. And if you have more questions, leave it in the comments. Before we begin, it's important to note that the process to becoming a GP can be different for everyone. I'm taking you through the most common and the most general approach here. The first step is to obtain a medical degree. So this can be in the form of an undergraduate degree, such as an MBBS, which you do straight out of high school, or in the form of a Doctor of Medicine degree, which is a postgraduate degree in Australia. Now, the more common pathway for a lot of you watching, I assume, will be the postgraduate pathway. So you've done high school, you've completed an undergraduate degree, and now you're looking to study medicine. So the process for you would be to apply to universities such as the University of Melbourne, University of Queensland, and many other postgraduate medical schools. And to get into those schools, you need to have sat the GAMSAT exam, and they'll also look at your GPA from your undergrad. And if you have made the shortlist, they'll also call you in for an interview. Now that you've obtained your medical degree, the next step is to get general registration. To get general registration, you need to complete a 1-year internship at a hospital that's recognized by the Australian Health Practitioners Regulation Agency, also known as APRA. Now, this is a year where you're working full-time as a junior doctor and you get hands-on clinical experience. And at the completion of the first year, you get general registration as a doctor. The next step for you is to actually do your general practice training. So during your intern year, you can apply to the Royal Australian College of General Practitioners, so RACGP, and if accepted, you will begin a 3 to 4 year process of completing your GP training. Now, the actual training pathway consists of a hospital year, but majority of the training you would actually be in a clinic and working as if you're a GP, but you'd be under a consultant, as well as you'll have some workplace-based assessments and examinations to get through. Step 5 is to gain your specialist registration. So at the end of your GP training, you have to sit a fellowship examination. Once you pass that exam, you can apply to be registered under APRA as a general practitioner, and you can work independently as a GP anywhere in Australia. So that's the general process of becoming a GP in Australia. So you have to do medical school, then you do your intern year, that's your general registration year. Then you apply for GP training. Once that's completed, you have to sit the fellowship exam, and once that's passed, then you can apply for specialist registration. Now let's look into some of the more frequently asked questions about GPs. What a lot of people consider is, can I specialize as a GP in Australia? And the answer is absolutely yes. A lot of GPs have special interests such as pediatrics or mental health or dermatology. There are some extra diplomas you can do whilst working, and once completed you gain skills and you're allowed to do more things, and your scope of practice can become a little bit more niche. The other question is it necessary to join a training program, or can I be a GP without it? It's absolutely essential to go through a training program in Australia to become an independent GP. Because in the process you get to learn many things, hands-on experience from many consultants, as well as you get to sit all of these exams to make sure your skills are up to date. Whilst it is possible to become a doctor without your fellowship, it can limit your scope of practice and your earning potential quite significantly. There you have it. This is a step-by-step approach to becoming a GP in Australia. Now, the path is long for sure, but if you're passionate about healthcare and you really want to become a GP, for a lot of it, you are working and you are earning. It's just your medical school years that you're not earning, and obviously getting into medical school can be a bit of a process. But hopefully this video was helpful in planning out your future. And if you have more questions, you can either comment or follow me on Instagram, and you can always message me on there. Thank you very much, and I'll see you on the next video.